about 2 years of research on our end, but for many of you, really the culmination of years and years of research. And so it's really quite a pleasure to be able to share our work and have you share your work in what we hope to be quite an intellectual community of thinkers and talkers and strugglers today on a critically important issue: psychological trauma in the lives of children, particularly low-income children, and the relationship between their lives and experiences and the key institution in their life outside of the home, their schools. I just want to say before I introduce our beloved Chancellor to kick things off, just a word or two about the genesis of this work, because we are not psychologists, although we have very capable psychologists working with us as an interdisciplinary law school center. We are primarily lawyers and policy people, and so the connection to psychological trauma came sort of through the back end of civil rights. And I had been working on a book called The Price of Paradise, The Costs of Inequality and a Vision for a More Equitable America. And I had been for many, many years a civil rights attorney focused on issues of poverty, particularly concentrated poverty in cities, and then over time into suburbs as the scope of issues became far more metropolitan, as many of you know. And as a structuralist, I was focused much more on sort of issues that you can see from 5,000 feet above these communities. Of course, I cared about what happened on the ground, but I, as a matter of analysis, tended to look above, because as lawyers do, we're looking at rules, we're looking at structures. And what I consistently found, though, at the individual level, was that there is a cumulative effect of so many of the structural oppressions that face particularly vulnerable populations, and that they are manifest in the most personal possible ways, through people's psychology and through their physical well-being, and of course then through their relationships. And so it became imperative to take a harder look at this. And in the chapter in that book on poverty, I spent a fair amount of time in some of the places I've done research before, but particularly in Philadelphia, where I was acquainted with the work of a group of social workers and learned much more about the pervasive extent of traumatic experience and its effects in the lives of low-income kids that they saw coming through their offices in areas of really catastrophic poverty. And then I began to do more research into it and was really shocked to learn just how well known this was outside of policy and legal circles, how pervasive it is, and then of course how much sense it all made, that the hardships that many of us talk about in other contexts would settle psychologically within the person and have profound effects at every level of someone's being, in their relationships, in their emotional well-being, in their cognitive capacity, in their psychological makeup, in their neurobiological wiring, in the way that they would interact with the institutions in their lives, that it would be a primary contributor to the school-to-prison pipeline, that it would then affect other life prospect outcomes, and ultimately that it would affect health outcomes to the point where the litany of illnesses associated with America's poor read like so much of the research associated with pervasive, severe, often complex psychological trauma. And so it struck me that there's really no way to do the work of civil rights against structural inequality without recognizing these profound implications for the person. And we then began this project. A lot of it started with my asking questions of brilliant friends of mine, like Alicia Lukachko, Dr. Lukachko, who's sitting here. We would sit and have breakfast, and she would explain some of the public health dimensions of these things for me. And then shortly afterwards, the design of a project was born, with considerable support from our then brand new, almost brand new, Chancellor. So I wanted to give you the genesis of how you got to be here today, because it was really that set of threads and inquiries that led to a recognition that we better get on this. we better get on this in law. And we need to learn what other disciplines have known for some time, and other disciplines need to work with us, because this isn't something that can just go on, right? This is, I mean, we have to treat this like the public crisis, the public health crisis that is, the idea that people could be suffering as profoundly as they suffer, and that we don't have adequate resources on their behalf, and that they are struggling uphill against in a resiliency battle unknown to many Americans. It's just frankly unacceptable. And so, so I just hope that we can be a venue, one of many, in which this discussion about the dimensions and the remedies for pervasive psychological trauma in the lives of our children can occur. On to our Chancellor. So, of course, I had to prepare some remarks because that's what people do when they introduce people, but it's always a little bit difficult for me because this is somebody whom I deeply care about and have been very fortunate to know. We are very fortunate here at Rutgers University to have stolen her, did we steal you? From Syracuse University a few years ago, and she has really helped to transform this school, but not in ways, and this university, but not in ways that were foreign to it, but really to amplify its strengths. It's really what you want in a partnership, right? You find a partner who complements the things, the best sides of yourself, is able to gently critique the things that could use some constructive improvement, and then bring a kind of a set of resources that were just beyond your grasp to make you all that you could be, right? And that's really what Dr. Nancy Cantor has done for the university, for the law school, and for CLiME and me. So here's the prepared stuff. She's a passionate dreamer with a commanding vision on how universities can and must be anchor institutions. But this is important too because it's really about a vision. And we as an institution in the middle of Newark, and so many institutions, could engage much more deeply in the health and growth of the communities we're a part of. So her plan, the strategic plan, our plan, reflects many of the priorities and initiatives that Nancy championed as the Chancellor and President of Syracuse University before she came here, such as pursuing cross-sector collaborations and local engagement in areas such as environmental sustainability, art, technology and design, neighborhood and cultural entrepreneurship, urban school reform, big area of work we're doing here, and the creation just across the street, you may have seen the construction site of the Rutgers Honors Living and Learning College, which is unlike any honors college probably that you ever imagined. We already have an honors college. This is going to be quite unique and really groundbreaking in its recognition of the myriad ways that talent manifests itself among young people, particularly young people who are overlooked, despite the fact that they have demonstrated unbelievable grit and talent coming from many of the blind spots in this country. So her support for publicly engaged scholarship gave rise to a seed grant program a few years back, and we were a recipient of that. And as I said, this conference is a direct outgrowth of Nancy's generosity and vision. Finally, however, I just want to note that Nancy gets to return to her home discipline in psychology. Prior to her appointment at Syracuse, Dr. Cantor served as Chancellor of the University of Illinois at Urbana-Champaign. She was Provost and Executive Vice President for Academic Affairs at the University of Michigan, after having served as Dean of Michigan's Horace H. Rackham School of Graduate Studies and Vice Provost for Academic Affairs. She is a professor of psychology and a senior research scientist at the Institute for Social Research at Michigan. She was, and she was also the chair of the Department of Psychology at Princeton University. So with all of that, I want to welcome Dr. Nancy Cantor.
He's tall and amazing, as you can tell. So really, I am so delighted to be here with you today, and I'm going to speak very quickly and briefly because you have so much really important work to do. But this Interdisciplinary Action Research Conference is precisely what we want to see at Rutgers University Newark, and as importantly, in cities like Newark. I hope you forgive my pointing to both the action research tradition and to the place of this gathering, as I'm a social psychologist, as David said, and high-impact scholarship that takes context and the systems that define it into account is extremely important to me. There's a seamlessness to be recognized, and I would argue nurtured, between who we are as educational institutions and the places in which we reside across generations and for the sustainable future. In that regard, Newark is a place where generations of resilient people have migrated south to north and immigrated from diasporas around the world seeking opportunity for their children, only to too often see them trapped by what David calls spatial inequities that almost inevitably expose them at higher rates than in other places to the complex traumas that you work on and will be talking about today. This is a place where tremendous intergenerational strength and potential resides, at the same time as the legacies of the architecture of segregation can keep people literally stuck in place, as Patrick Sharkey would say. Trapped by neighborhoods with apartheid schools, as our law colleague Paul Trachtenberg and Elise Bodie and others have worked so hard to illustrate and show New Jerseyans about, where all the sequelae of poverty and systemic racism literally haunt the halls of education, derailing genuine effort by children, families, teachers, neighbors, in heartbreaking ways that you all know too well and study too often to rest easy. Believe me, no one in this highly diverse urban research university, an anchor institution whose identity is totally intertwined with that of Newark, is resting easy. Core to our work are partnerships in the city, for no one in this city is resting easy either when the next generation's talent goes uncultivated. This is especially true of our homegrown mayor, Raz J. Baraka, a poet and former school principal who welcomes the collaboration of our best researchers with his staff, many of whom are here today, and other public and private sector partners, aimed at what Raz calls the public health crisis, what you call the public health crisis, the derailing of our children from schools to the criminal justice system. This is something, as you know, that describes not just Newark, but communities all over this country and around the globe. So your expertise and creativity in confronting, with both intervention and prevention, the multidimensional systemic sources and complex causes of psychological trauma could not be more important and urgently needed. Complex psychological trauma stops our children in this city every day from thriving, as they so deserve to do. David mentioned the Honors Living Learning community. We see in that community Newark kids who got through, and we wonder how they did. And we equally see in that community new students who grew up in Newark and got derailed to the criminal justice system and spent as much as 30 years in prison and are now back here at the Honors Living Learning community. Because it's all our responsibility to find that talent. So intervention and prevention are literally, as far as we are concerned, at the heart of any movement for equity and justice here in Newark and in so many communities. There are, as you well know, far too many communities like Newark with high-density poverty, but living also with the legacy of America's discriminatory history. What my friend and colleague Rupert Nacoste, another social psychologist, calls hibernating bigotry. You know, as an aside, you hear all the time implicit bias. That's a little too calm for our taste. Hibernating bigotry is really what this is. And America's ambivalence to dismantling the practices and policies and institutions that perpetuate that legacy stand in the way of prevention and intervention for complex psychological trauma that derails the talent in Newark every day and unfortunately railroads it into the criminal justice system. So for Rutgers Newark, our investments in the seed grants that David talked about, like his amazing trauma schools and poverty one that spurred this conference, and allied ones on school integration, on youth violence and juvenile justice and health equity and social justice, just to name a few, really set the stage for what we want to be sustained commitment to being not just located haphazardly, as you will, in Newark, but truly of Newark. We're mobilizing collaborations to untrap our children's talent, in part by reinforcing the very institutions and reforming them, I shouldn't say reinforcing them, reforming them, the very institutions that are supposed to help children, but sometimes make it harder, as David's analysis of trauma and spatial inequality argues. So these collaborations engage as they must, and as you represent, multiple disciplines, in our case, law, social work, education, psychology, criminal justice, business, public health, and more. But as importantly, multiple systems and partners. K-12, of course, law enforcement, of course, various social service agencies, housing, the courts, you name it. As you know, it goes across. But also, and I really think this is something that is terribly important, and one of the reasons I really love what David's doing, is recognizing how critical spaces and places are. So we think institutionally, but spaces and places are equally critical. Neighborhood centers, hospitals, schools, faith institutions, the places and spaces, vacant lots next to schools. The places and spaces that become the cultivating of talent or the railroading of talent away from productive education. So we really want to render a kind of mapping that is both place-based and generalizable, that leads both from a description of what's happening, because that's what policymakers need to hear, and lawyers need to hear, but also an action map, because this is and has to be action research. And too little of what policymakers and lawyers, forgive me, hear. I spend way too much time with lawyers, although these ones I love. But too much of what they hear is descriptive and not action-oriented, right? So what you're doing today is collectively taking the wisdom of spatial and place analyses, of institutional analyses, and translating it to what intervention and prevention might look like. In this city, we absolutely cannot do it alone, and I would argue any place you're from, you can't do it alone. We need collective impact, whatever phrase you want to use. We need tables, literally, with all sectors around them. Public-private collaborations, where we pay as much attention to sustaining those collaborations so that we can do improvement science on those interventions and preventions, not assume that we've got it in a one-shot way. We have to commit, certainly higher education has to. Who are our students of the future, after all? Who should our students of the future be? I'm sure you've all seen Raj Chetty's data, or I hope you've seen it, on how few higher education elite institutions provide any kind of upward social mobility for the kinds of students and the kinds of talent that we're talking about in a place like Newark. So we welcome you here, and we welcome them here. So to put your work really in context then, and I'm going to use Newark as an example, but we have no, in this sense, pride of place, though we have tremendous pride in the city of Newark. But to put your work in context then, I think it's helpful to look at the various collective impact tables, if you will, that we have going on in Newark. Cross-sector collaborations, we're just one partner among many. But to think about how each one, progress in each one of these collective impact tables will be derailed just as the children are derailed by the very nature of the imbuing or imbibing of psychological trauma that you're talking about. So here are a few examples, and I hope you see the criticality of your work to them. In the Newark City of Learning Collaborative, we want to increase post-secondary attainment of the residents of Newark to 25% by 2025, from 18.1% as it stands right now. But that can't happen if childhood trauma derails our youth's development and education. So we start there, right? We start with post-secondary attainment. That isn't going to happen if they're derailed. And then we move to our University-Assisted Community Schools partnership with Shabazz High School, one of the lowest performing schools in the district. We cannot derail the absenteeism and the dropout rate in Shabazz without confronting the prevalence of trauma exposure. As is also the case in our Opportunity Youth Network that we are a significant part of. Newark has anywhere from 4,000 to 7,000 opportunity youth, not in their seats, not making progress in high school and beyond. They can be opportunity youth, not disconnected youth. But you of all people, know where they'll get connected to. So again, your work is critical to it. They'll get connected in one form or another to the criminal justice system as fast as you can say it. But it's going to be slow, hard work to intervene, right? In our Live, Work, Buy local initiative, we want to spur equitable development and economic growth in Newark and make sure it benefits local residents. And in fact, David is helping to steer for the mayor a collective impact table thinking about equitable development. But that too can't happen without a talent pool that survives. So even something as sterile, if you will, as increasing local procurement to local entrepreneurs or hiring more Newarkers isn't going to happen if the children you're studying are derailed early on and the families are torn apart. In our Safer Newark Council, and this is perhaps the one you would most expect to be influenced, but we want to break the cycle of community violence, which is concentrated on only 20% of the streets of Newark. Only 20% of the streets of Newark have high community violence rates. But 20%, those 20%, right, with widespread and long-term deleterious effects on the children and families of those neighborhoods, as you know better than anyone. We can't reduce community violence on those 20% of the streets of Newark unless the institutions of law enforcement and of education team up in trauma-sensitive practices. We simply can't. It's got to be at the heart of that. So when as a social psychologist I talk to all my colleagues about implicit bias training with law enforcement, which many of us talk about a lot, what is often missing in those conversations is the connection to trauma-sensitive practices in schools, in neighborhoods. It's a relationship that from a policy level all sounds good, right? Community policing. But from a practical level, it is critical that implicit bias gets exposed because it's really hibernating bigotry, and it's not hibernating very much in our country right now. So I'm not at all saying those efforts are unimportant, but like everything else I've mentioned, those efforts are dependent on drawing them back and down and into the school and institutional and neighborhood context where the triggers will be tripped if the intervention and prevention isn't done. So as you all know so well, and I feel like a bit preaching to the choir, I hope, it takes the kind of comprehensive collective mobilization to realize the rightful dreams of a city like ours. And we, and I, dare say you, right, won't stop until progress is made. Therefore, what you're doing today and each day that you strive to make that progress on such timely and timeless work is one step further towards reminding people that this is a legacy we all have to take responsibility for. Every institution, every sector we're a part of. It's not someone else's job. It's all of our job. So thank you for pooling your expertise to pave a fairer path for opportunity for more children in more places like Newark. Really, have a wonderful conference. Thank you.
Not gonna make any height jokes. Thank you so much, Nancy. It's good to see you all. I just want to say before our first panel sits down, we'll probably take about, 3 minutes of transition. But don't be shy about the front rows. Nobody will record your name on a special list of backbenchers who wind up in the corner. Nobody will be offended. There are exams going on in the building today, and so there are a lot of anxious law students walking around. We tried to shield you from them. We'll see about lunch when we're going to be downstairs in the atrium. You may hear a few screams, but don't worry. It's not trauma. It's stress, right? It's stress, right? But they brought it on themselves, right? It's a rite of passage. And they'll be duly paid eventually for all of that. So we'll take 3 minutes, bathroom breaks, settling in, all that good stuff, and these folks will sit down, and then newly minted Dr. Alex Markovich will moderate the first panel. I just want to say this about the progression today, just so you know. There was a bit of a purpose behind the way we set up the panels today. So we begin where many trauma conferences begin, with a panel that first sort of makes sure we're all on the same definitional page, so that we have a thorough vetting of what psychological trauma means in different contexts. And so we'll do that. We'll then problematize that, if I can make up a verb. We'll problematize that a little bit in the second panel, where we talk about some of what that means in the context of particular institutions, particularly schools, and some of the mislabeling that then occurs. So if we sort of do labeling in the first instance, then we do mislabeling in the second, and help to show some of the problems that arise from not always a full or clear understanding of the terminology and the concepts behind them. Then at lunch,